As Natalie got closer to her due date, I kept asking her, so do you think you will be going into labor within the next 24 to 48 hours?
You were such a pain.
I think it was a real pain. But now that I went through the whole experience of childbirth, I know that it really just comes down to 3 simple signs that you need to pay attention to if you want to find out if labor is only just 24 to 48 hours away. That is what this video is about.
Yes. I am Natalie, a pregnancy and birth consultant and TCM therapist.
And I am Matthias, a researcher and science geek, and we are here to help you and your baby naturally and science-based.
For more useful tips and tools on pregnancy and baby related topics, subscribe to our channel and hit the bell if you like.
Alright, so when we talk about the signs that labor is 24 to 48 hours away, then what we mean is active labor as opposed to early labor. Early labor can start hours, days and even weeks before your due date, and you may or may not feel any contractions during that time. However, active labor is when it really gets down to the nitty-gritty of the whole labor process and when you are going to feel those intense contractions.
Exactly. So the first sign that active labor is 24 to 48 hours away is that your water is breaking.
Yes, so during your pregnancy, your baby is surrounded by a sac full of amniotic fluid which protects your baby.
Yeah.
But eventually, the pressure on the sac will be so high that the sac ruptures. And this is referred to as your water is breaking.
Yes. When your waters break, you're going to leak amniotic fluid. So there is going to be a notable wetness.
Yeah.
However, for some women, it may only just be a trickle. Others describe it as a gush.
Yes, for many women, breaking water is the very trigger that makes them go into labor within 24 hours. But keep in mind that this does not apply to all women because most women go into labor even before their waters break. For them, breaking water is just a part of labor. So it really depends on your body what it's gonna be.
Yes. The next sign that labor is 24 to 48 hours away is that your cervix has dilated to 2 to 3 centimeters. As you're getting closer to your due date, your cervix is going to thin out and dilate to 10 centimeters so that your baby can move into the birth canal. However, when you are about 2 to 3 centimeters dilated or more, then chances are that active labor is only about 24 to 48 hours away. And that's because in order for your cervix to dilate further, you're going to need the kind of contractions that you have in active labor.
Yes, and if you now say to yourself, fine, but the problem is I don't know if I'm dilating, so how should I know if labor is near? Well, in that case, we recommend watching our video about cervix dilation symptoms and how to check yourself if you're dilating.
Right. And should you find out that you're not dilating at all so far, then check out our video on how to dilate faster, because that video helps you soften your cervix and get contractions going.
Right. But if your contractions did start, but you're like, does this take long because you're dilating so slowly, then check out our other video about how to dilate faster once your contractions have started.
Okay, so back to our signs that labor is near. The third sign that labor is about 24 to 48 hours away are real contractions. Up to this point, you may have felt so-called Braxton Hicks contractions, but these contractions are not real. They come irregularly and they are fake.
Yeah.
So in order to evaluate if you are 24 to 48 hours away from labor, we need to look at the intensity, regularity and frequency of your contractions.
Yes, so during the early stage of labor, you may or may not feel mild to moderate contractions, which may last between 30 and 90 seconds. But the key here is that, unlike Braxton Hicks, real contractions come in more or less regular waves. Also, at first, they may be some 30 minutes apart, but eventually they're going to come in closer and closer intervals. Now, if your contractions start to feel more intense and if they become more frequent, you can usually expect to go into active labor within 24 to 48 hours.
Yes. So at the end of early labor, expect to have contractions like every 5 to 6 minutes. And then once you feel very intense contractions that last approximately between 45 and 60 seconds and come every 4 to 5 minutes, then you are in active labor.
When this happens, don't be surprised if your birth partner freaks out and calls your midwife or doctor. It's probably not the worst idea at this point. Sorry, you were saying?
Nothing.
I know. And then one final remark, just because we hear it all the time at the clinic, nesting is not necessarily a sign that labor is 24 to 48 hours away. I mean, personally, I was quite surprised when Natalie started to remove my stuff from our closet in order to make space for the stuff of our son.
I'm so sorry.
No, that's okay, I'm a big boy. But she started doing that way before she was even close to early labor.
Yeah.
And we know lots of other women who also started nesting way before they went into labor. So no, nesting is not a sign that labor is very close.
Right. If you have found this video helpful, we would be super grateful if you could leave us a like or even a comment in the comment section below. Any feedback is more than appreciated.
Yes, and for more useful tips and tools on pregnancy and baby related topics, make sure to subscribe to our channel and to hit the bell.